औज़ुबिल्लाहिमिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम अर्रहमान अल्लमल कुरान खलक़ल इंसान अल्लमहुल बयान। तो आज एक और टॉपिक के साथ आपके साथ सामने आए हैं, लेकिन उस टॉपिक से पहले याद रखें कि मूवमेंट इज़ द सॉन्ग ऑफ द बॉडी। सो आपने अपनी ज़िंदगी को स्टेगनेट नहीं होने देना, हरकत में रहना है। आज मैं आप लोगों से कुछ चीज़ें एबनॉर्मल मूवमेंट के बारे में डिस्कस करूँगा। तो सबसे पहले इंट्रोडक्शन। Abnormal movement disorders in children result from the dysfunction of the motor control pathways in the central nervous system. Remember, motor control pathways in the central nervous system, which present as involuntary movements. So, two things important is the motor control pathways and the central nervous system. Now, they are categorized as hyperkinetic, that has increased frequency like such as chorea and tics, and hypokinetic such as Parkinsonisms. The causes can include genetic disorders such metabolic abnormalities, autoimmune conditions, infections, and structural brain lesions. Early diagnosis and management can significantly improve the outcomes. So, clinical presentation, what is a chorea? Chorea is an irregular, rapid, unpredictable movement, often affecting the limbs, trunk, and face. So, now something about the chorea. See the rapid movement. So, as you have seen, they were irregular, they are rapid, and they are not predictable movements, and they were affecting the limbs. Now, the dystonia, which is a sustained or intermittent muscle contractions causing abnormal postures or twisting. So, see the dystonia. This is sustained contractions. In this case, the neck. There is a pronator sign. See that this is sustained contractions in the neck. So, after dystonia, then there are tics. Tics are the sudden, repetitive, non rhythmic movements or vocalizations like blinking, sniffing, or throat cleaning. Remember, sudden, repetitive, and they're non rhythmic movements. So, now see the tics. See, the rhythmic, in this case, this is blinking. This, see, this is non rhythmic. See, in this case, eye blinking, this is head nod. So you have seen they were the sudden, repetitive, non-rhythmic movements and such as blinking. Then is the tremors. Tremors are the rhythmic oscillatory movements often involving the hands or head. So now you see they are the rhythmic movements of the hands. This is a typical tremors of the Parkinson's disease, though we can't see it in the pediatrics, but to give you an idea of what are the tremors, so that you should see these are the tremors. They So the tremors are rhythmic oscillatory movements which you have seen. Then there's a myoclonus. So myoclonus, they are the brief shock-like jerks of a muscle or a group of muscles. Let me tell you something about the myoclonus. You see the jerky movements of the limbs. This is the myoclonus. There are different causes of the myoclonus. Just to tell you about the movement. And then there's ataxia. It is an impaired coordination of movement, and it is unsteady gait, and there's a difficulty with the fine motor skills. Now this video is copied from the YouTube, and not my personal video. And look, this gentleman is telling us about the myoclonus. the jerky movements, is unable to hold the balance and not staying steady, and when the person will walk, not be able to walk in a straight line. It is trying to fall and trying to use different things to maintain the posture. See, so this is he is showing that is not able to stand properly or walk in a straight line. So, what are the findings in the history? You have to ask whether this was acute or chronic, this is static or progressive. Then you have to ask about the triggering factors like infections, medications, emotional stress, or metabolic imbalances. Ask about the family history because such are hereditary conditions like Huntington's or Wilson disease, and the perinatal history, risk factors such as birth asphyxia, connectitis, or neonatal infections. Then is associated symptoms such as cognitive decline, seizures, or other neurological signs. Then there's a developmental history, ask about the regression of milestones, and they may suggest neurodegenerative disorders. So the examination look for the systemic signs such as hepatosplenomegaly or skin findings, cafe au lait spots. Neurological examination complete, which will tell muscle tone, strength, reflexes, coordination, and gait assessment. Then movement analysis. You have to analyze what is the type of movement. It is hyperkinetic or hypokinetic. In this way, you can distribute it whether it is a hyperkinetic, so chorea, or hypokinetic tremor, and its distribution in associated features. Then eye examination check for the KF rings, which are present in Wilson's disease, or optic atrophy, which are present in mitochondrial disorders. Then the differential diagnosis, infectious causes, citizen chorea, post-encephalitic movement disorders, genetic and metabolic disorders like Wilson disease, phenylketonuria, or mitochondrial diseases, and autoimmune, pediatric autoimmune neuropsychiatric disorders, PANDAS, and autoimmune encephalitis, functional disorders such as the psychogenic movement disorders, and drug-induced or toxic causes, which are occur in the drugs such as antipsychotics, which causes tardive dyskinesia, toxins like lead. So treatment, the general principle is treat the underlying cause. If there are infections, treat infections. If there are metabolic imbalances, control it. Symptomatic treatment for improving the quality of life. So for chorea, dopamine depleters, tetrabenzene, antipsychotics such as risperidone, haloperidol may be useful. In case of dystonia, anticholinergics such as trihexyphenidyl, botulinum toxin injections for focal dystonia. While in case of tics, clonidine, guanfacine, or antipsychotics for severe cases. Myoclonus, benzodiazepines, clonazepam, or levetiracetam, and for case of tremors, propanol or primidone if disabling. So, non-pharmacological treatment such as a behavior therapy, particularly useful in tic disorders and functional movement disorders. Physical therapy improves coordination and prevents contracture in dystonia or ataxia. Deep brain stimulation for refractory dystonia or chorea. Then disease-specific treatments like for Wilson disease, chelation therapy such as penicillamine, zinc supplementation, in sedentary chorea, antibiotics, effective streptococcal infection, immunomodulatory therapies in severe cases. In autoimmune encephalitis, steroids are given along with IVIG or plasmapheresis. Supportive care, nutrition support, speech therapy, occupational therapy for children with severe disabilities. So, few things that abnormal movement disorders in children require a multidisciplinary approach. Early identification of the underlying cause and timely initiation of treatment is crucial, and long-term follow-up with a neurologist, physiotherapist, and psychologist is often necessary. So I thank you very much for your listening. This was a short discussion about the abnormal movements which you come across in your clinical examination and as well as in exams. I hope it will help you, and I will looking forward for your feedback. And I finish today's lecture by praying that Allah Pak be our helper, protector, and guide. Allah Hafiz.